We'll go ahead and get started. Again, my name is Chuck Carney. I'm Director of Media Relations for Indiana University, and welcome to our weekly briefing with the City of Bloomington Mayor's Office, the County of Monroe County, IU Health, and Indiana University. A reminder of who is going to be here: Mayor John Hamilton of Bloomington, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shakman, Monroe County Health Department Administrator Penny Caudill, Monroe County Emergency Management Director Allison Moore, and IU Associate Vice President for Public Safety and Institutional Assurance Ben Hunter. So we'll go ahead and get things going first with Mayor Hamilton.
Okay, thanks. Thanks so much for everybody being here. I'll give some quick updates. The continuity of city government, our work focused on city government is continuing to evolve, including implementing new mask protocols. Can y'all hear me okay? Is that all right? Okay. New mask protocols, really consistent with the changing just a week ago or so of CDC and Health Department and others. We're also implementing the Families First Corona Relief Act, which more than 40 of our employees so far have signed up for that, which gives some relief to employees for paid time off and extended family medical leave. I want to report as well the Social Services work group is hard at it. They've really identified about 230 slots of childcare that are needed. They're seriously negotiating, working on sites, staffing, finance arrangements for that to help support the essential workers in our community, both healthcare workers and their needs for childcare, as well as first responders. Housing effort also underway with that group. I can report, and Commissioner Thomas knows this as well, as we've been working together to identify how to help bring in some substantial support from the Family and Social Services Administration at the state level to help stand up some more capacity for isolation for individuals who don't have a place to isolate when they have a COVID confirmation, or don't need to be in a hospital or need to be self-isolated. So we're working hard on that with the county and health and many partners locally. The food security work is also underway from that social services work group. The employment stabilization and recovery work group also has been very busy this week. Many of you know this as well already. There's $2.5 million that's been appropriated now for economic recovery locally. Applications opened yesterday. That was an 18-day process from the beginning of that group to opening up those applications for that funding. They hope to begin distribution within a week. They've also stood up something called Ask the Mill and some technical assistance on the economy side, and I won't go into longer on that. They're continuing longer term planning. I'll close with just a personal note. I don't know if everybody saw this, but I thought I ought to at least mention we did put out a release today that my wife has become a confirmed COVID-19 patient. She is self-isolating. We got test results yesterday. We've gotten tons of good wishes. I appreciate that. I share this really for two purposes. One, a reminder that the virus is here, and our continued good efforts to protect its spread with physical distancing and all are important, as Dawn is now one of the 70 confirmed cases we have in Monroe County. And second, really just as a reminder that it's okay, that there is no stigma in getting this sickness, that many of our friends, neighbors, and family members may get it, have it, may get it, and that's okay as we focus on treatment and taking care of each other. And so it's not, none of us, the virus is the enemy, and it's okay when to share what's going on. So we wanted to do that, and we will be following all the protocols and treatments as advised by our wonderful health professionals. So I just wanted to note that as well, and I'll hand it back to you, Chuck. Thank you.
Well, thank you, Mayor Hamilton. Of course, all of our thoughts go with you and your wife, and
Thank you.
for a full recovery.
Thank you.
Let's go then to Julie Thomas. Julie?
Got it. Thank you. I had unmute. Thank you. Computer got a little stuck. Yeah, best wishes to Dawn and your family, and to anyone in the community who's dealing with this personally. It's a tough diagnosis. I just want to start off on a really positive note and talk about the National Public Health Week that we're in the middle of, appropriately enough. Special thanks to Penny Caudill and her staff, to all the good folks that are working in the medical field in our community who are getting us through this every day. So thanks to everyone in that capacity. We do want to thank all the essential workers in our community, and for me, my staff, my colleagues, the legal staff, Allison Moore, just a lot of really good folks who continue to work really hard day after day after day without a day off to do what's best for our community. As Mayor Hamilton mentioned, they are looking for, there is a search now for people who can assist essential workers who need childcare. You can find information about this on our county website, co.monroe.in.us. And there are about 230 children of essential workers, and we need healthy childcare workers who could be educators, teachers, college students, anyone with childcare experience, full or part-time, and so all of that information is on our website. Also, a note for businesses outside the city of Bloomington who are involved in any way in the tourism field. We have food and beverage support dollars available. The council still has to appropriate those this week. Hopefully they will. I believe they will. And if anybody is interested in applying for a no interest loan or a grant from this fund, we invite you to visit the Monroe County website, co.monroe.in.us, and to fill out a short one-page application for us, and we will be looking at those on a weekly basis, on a rolling basis. I do want to just acknowledge the fact that the county and the city are working together to pull this FSSA grant funding into Monroe County to help those who are most vulnerable in our community and to protect our community at large. So I'm really excited about the opportunities there. Thank you.
Okay, turn it over to Brian Shakman.
Good afternoon. Again, I would also echo thanks to all those who are doing a great job in our community. We have a great I've said it before, but we have next to none in our health department and support in this county, and we need to be proud and really reward them for the great work that they're doing. Just fantastic. Great collaboration, and we couldn't be more pleased, and I couldn't be more pleased to be here and a part of it. We're also grateful for all of our team members that, as Julie said, they're working, some of us 7 days a week, and nurses who are working tired but getting respite through generous support, through donations of food. We've been able to have hotels who have supported us, and the university, the dormitories, and it's just been fantastic for our team to know that they're cared for, that they're supported, and that there is that outreach. I want to talk about three things here quickly. First, the new weekly data that came out to all the press just today, testing expansion, and talk a little bit about that, and then some surge planning information, follow up on our last talk last Friday. So first of all, we're the first, IU Health is the first health system and healthcare entity to release data. This has taken some time for us, as you can imagine, to be sure that the data is accurate, reliable, and that we're pulling it from all the sources. But we want to be sure that we're giving a regular update to our community and to the media regarding where we are with treatments of our COVID patients, as well as other community data that we're working with. So we're going to start releasing, we released today, but we're going to start releasing data every Monday. So the Monday of every week, we'll put a release out to all the media and all of our partners. And these numbers are going to be the total numbers of screenings, of virtual screening clinic, tests conducted at the IU Health Pathology Lab, number of confirmed and suspected cases in our IU Health hospitals, percent of ICU beds and ventilators used in our system. This will be a system number, not a regional number, because we move those around throughout our system, so those numbers at a region or location change daily. A number of IU Health team members who have tested positive, as well as a number who have returned to work, which is always good. So let's talk a little bit about that. The sheet that was handed out, virtual screenings to date, or over 24,000 virtual screening visits have been completed here in the state of Indiana through IU Health. We've done over 5,600 tests based on screening criteria to different patients. And then our patients in IU Health hospitals in the South Central region, 26 confirmed, 16 are still waiting results, and those results turn around within 24 to 36 hours, and 40 for a total of 42 patients as of yesterday. Those numbers, of course, change daily. We're discharging patients at the same time we're admitting patients, and so it's not a static number, but we're going to give it to you every Monday so that you can kind of see that trend, and hopefully we'll start seeing Mondays where we report less numbers in those three categories. In our South Central region, as far as our team members, we've tested 361 team members who have displayed symptoms. 36 of those, or about 11%, have tested positive. And again, thank you to the hotels and to IU and others where we can send those individuals where they can receive free get meals and care that they need. We've quarantined 376. So that's not just those who are testing positive, that are those who until we can get a test and figure out if they have it or not, getting them isolated away from their families, potentially, or away, of course, away from the workplace. And of those 376, 232 have returned to work. And of course, that number is not static either. That is a continuously changing number. So about 62% of our workforce is returning back every time we test. So that's a good thing. As far as our supplies, masks, PPE equipment, testing, media, all of that, we're in very good shape. IU Health has been able to secure some great suppliers, and we've been able to put some real good conservation policies and procedures in place around CDC guidelines and the best evidence, and so we're doing well there. 48% of our ventilators are being utilized across the state in IU Health hospitals. That just includes ventilators. That does not include additional machines like anesthesia machines and others that can be converted to ventilation. That's just those ventilators that we've got in our care areas, ICUs, and units that we've converted for COVID. And then our ICU bed utilization is 59%. So you can see we've got a great deal of capacity as we plan for a surge. If the surge is still to come, we're ready for that. So I just wanted to review that data. That data will continue to come out, as I said, every Monday. Currently, for our South Central region, we have seen 66 patients that have been admitted to our hospitals in the South Central region. 29 of those have been discharged, and 26, as I said, are currently in our hospitals in the South Central region. And then finally, testing. During this time, testing has been a concern because of just being able to get tests and get the testing equipment and everything up and running. IU Health was one of the very first in the state of Indiana to get that up and running other than the Indiana State Department of Health. And so we started with phase one, which was our healthcare workers, making sure that they were getting tested, and our patients, of course. And now we've expanded that to first responders. And last week we tested several first responders in our communities and other healthcare workers of other facilities in our community. And now we have expanded that to outpatient testing. So we have opened what we're calling a sick clinic. So if you are affiliated with an IU Health physician, or you go to one of our walk-in clinics, and you display the symptoms that meet criteria for testing, the physician, it has to be with a physician's order, but the physician now places the order and we do the COVID test. And Mayor, I hope your wife does well, and sounds like she will, and you as well. But that was part of that process worked for her. She was able to see her doctor with the symptoms and get the testing done, and that was expanded this week for all outpatients who see their doctor or call into that nurse line and get screened, and then we test them. So those are the three things I wanted to cover. Surge planning. I did want to speak a little bit about surge planning. You know, the question is what happens when this is over, and that's a question a lot of people are asking. And we use, as Allison can speak better to it than I, the Healthcare Incident Command process. That's a national process out of 9/11, and that process helped us ramp down by priority our different procedures, our different testing areas, our different operations, and that plan also then gives us a schedule and gives us a prioritization of how we ramp back up our operations. And so we've already begun that discussion, knowing that we will be ramping back up our operations, and it will take some time. So we won't just turn it on all at once. We need to be sure that when we do ramp back up, that patients are safe, that we do it in a way that patients have access, and also in a way that we give priority to those who were rescheduled first, and those who are in acute condition. So just wanted to let everyone know that we've already begun the discussion around ramping back up, what that looks like, and that will take us a couple weeks. It took us a week and a half to 2 weeks to ramp everything down, and it's going to take us that time period to ramp up this large operation as well.
All right, thanks, Brian. We'll go to Penny Caudill, Monroe County Health Administrator, Health Department Administrator. And Penny, I do have your visual aids on hand to try to share if you just want to give me an obvious cue and you want to do that. Penny, you still there? Okay, we may come back to Penny Caudill here in a moment. Let's go to Allison Moore, Monroe County Emergency Management Director.
Good afternoon. Thanks, Chuck. We are still under a local emergency declaration. We will remain under that local declaration following, given the governor's orders. We will stay under our current declaration. We continue to work with the Indiana Department of Homeland Security for PPE requests. As you know, and as many of you know, there's a shortage of supplies, and they are very hard to get. We are continuing to fight for Monroe County and the supplies that we are in dire need of. We currently have enough supplies for all of our first responders for at least the next 30 days out. So rest assured that we have secured supplies, but we are looking long-term and worst case scenarios, and we'll continue to fight for that PPE. The CDC, as well as Monroe County, made a recommendation earlier this week to wear masks when you are out within the public. So we're asking that you have face covers when you are in the public. That should not mean that you still have to follow social distancing, even when you have those masks. So we're encouraging people to wear face covers and continue that social distancing. But because of that, we are in dire need of masks. So if you are a mask maker, I know I repeat this every week on this press conference, but more and more people are watching this, and we want to continue to get the word out of where those are being collected. We currently have many sites throughout the county in order to collect those. Those sites are located on our county website, which is co.monroe.in.us. There's a direct link. It's a green colored link where you can click on, and it gives the addresses of the places where you can, in fact, drop those masks off. We encourage you to drop those masks off while you are in going to an essential need, or dropping them back off when you are on your way back home from an essential need. But again, since we are in such dire need, we also encourage you to go drop those masks off and then go back home and, of course, continue that social distancing while doing so. We are collaborating with all of our partners on surge plans in the event of a medical surge, as Brian spoke about. We're very fortunate here that our hospital has wonderful incident command plans and procedures already in place. They've worked very well in collaboration with our office way before any pandemic ever hit Monroe County. We're very fortunate here with the collaboration amongst their preparedness division within their hospital. And we are following those plans and procedures for medical surge and feel very confident that we will continue those efforts amongst this pandemic. The Emergency Management Office continues to work with public safety agencies on mutual aid plans and the continuity of operation plans, making sure and ensuring that there are no gaps of service during these vital times. It's been a very busy week as we continue to ensure that we have plans and procedures in place to continue all services for the residents of Monroe County. That's all I have at this time.
Okay, I'll check back. I didn't see if Penny Caudill rejoined us. Penny, are you there? Technology is great until it isn't. So let's go then next to Ben Hunter from Indiana University.
All right, thanks, Chuck. And like everyone, Mayor, we give our best to you and Don and hope for a full and speedy recovery. What's going on at Indiana University right now? Our residential program and services and our emergency operations centers are working on Briscoe, getting it ready for respite care for IU Health. That process is taking place on the Bloomington campus. We're also doing that on the Indianapolis campus, working with IU Health, and our housing and facilities folks are packing up students' belongings, storing them, getting those facilities ready. Those are major undertakings, as you can imagine. A lot of students left their stuff for spring break, and then we asked them to stay at their permanent residence. So we notified those students. We have movers in. We're carefully going through that process and getting the dorm space ready, and then working with IU Health on those procedures right now. So I appreciate the internal effort that's taking from our teams, and IU Health has been excellent to work with. On the PPE front, like others, we continue to look at our supply and stock. Our student health centers have adequate supplies right now. Our focus has been to assist mutual aid requests where we can. We can continue to do that, and we're continuing to work with our purchasing partners to find additional supplies. As you can quite imagine, they're hard to get, from the 95 masks to gowns to gloves and goggles. We are also working with the state of Indiana on those requests as well. We've teamed up with them and some supplier lines in terms of looking at different vendors and making sure that we're getting the right stock in place. There are a lot of counterfeit operations going on, as the media has talked about, and so we're trying to make sure that what we buy is what we need and the right stock in place. Our partnership with BPD continues to be great amongst the two police departments, the IU Police Department and the Bloomington City Police Department. I think the message has gotten out to students that have stayed in Bloomington, off-campus residents. I know, at least from the IU Police Department, we've sent some cases over to student conduct for partying, but the social distancing and physical distancing message has gotten through. Those runs seem less frequent. And so the education campaign has worked really well between the city and IU, and so we continue to appreciate that partnership. Right now on our campuses throughout the state, our essential employees are there. They're working hard. They're obviously practicing those physical distancing measures. We have, whether it's facilities workers or whether it's RPS, and because we still have some students on our campuses that couldn't go home to their native countries, or they have situations here in the United States or in Indiana that requires them to live on campus. So we have very, very few students, but we obviously still are having our essential employees service their needs while on campus. So that has worked out well. And we're continuing through those processes and working with our employees to make sure we keep them safe in the interactions throughout our campuses. Thank you, Chuck.
All right, thanks, Ben. We're going to go back to Allison. She is going to give Penny Caudill's update.
Thank you, Chuck. We are trying to do our best. This is a holiday for government, and so we were trying to work, even though we're essential, from home today, and sometimes that provides some additional technology difficulties. And so though we've been working fearlessly, we have been trying to do that from home. And so unfortunately that didn't work so well for Ms. Caudill and her Wi-Fi. She has 3 updates though, and they are: this morning, the Indiana State Department of Health released information that Dr. Box would like all negative test results to go to the state. So in the past, those results did not have to be recorded, and now they do. So that could in fact increase, or will in fact increase, the number shown of tests that are being provided that did not have to be required before. The governor released expanded guidance on worship for faith-based in regards to it being Easter weekend. So we encourage those faith-based organizations to check out the CDC or the state's website in regards to those governor orders. And then lastly, Chuck, there were 2 flyers that Penny had for you. I know you had spoke of those earlier on this press conference. She has 2 IU students that have worked on these different flyers. They're both regarding face coverings, and she would like for those to be shown and then of course shared with this for others to be able to utilize proper face covering protocols that they've created.
I am attempting to do that as we speak. But I don't see them to be shared here, even though they're open on my computer. So still efforting.
We can share those on our county website, and we can also get those to Mayor Hamilton to share for the city as well.
Here's one.
Awesome.
The guide to masks. And there should be another here.
Look at you, Chuck. You're killing it. Nice job.
If all of us are not experts at Zoom by the time this is over with, we haven't really been using our time very wisely.
Absolutely.
There you go. There's the other one. I think I need to increase the size.
Hey, Chuck, can you hear me? This is Penny.
Yeah, Penny.
Hey, sorry. So I apologize so much. Thanks, Allison, for sharing that. We are really happy to be able to, with the IU students who, with school leaving and, being virtual and internships kind of being upheavaled, we took on some extra students to work off-site to just finish up their hours and help us out. So we're really happy. They've been working on a lot of different messaging for us, and these are just 2 of the latest things that they came out. We wanted to share those and say thank you for that.
Well, thank you, Penny. Appreciate it. So now we will go ahead and open this up to questions, and I'm going to start with Ethan Burks from WTIU, WFIU News. For Mayor Hamilton, could you please take us through the timeline of your wife Dawn's diagnosis? When did she first start experiencing symptoms? What kind of process has your family gone through in notifying people you've come into contact with? And how is she doing? And everyone here at the station wishes her a healthy recovery, he says.
Well, thank you very much. I appreciate it. Dawn has been actually very careful and isolated for quite some time before she had any symptoms. And she had symptoms just a few days back and got tested this week and confirmed on Thursday. So she's not been in touch with anybody. I appreciate your good thoughts. She is at home, and I don't really want to dig into all the details, but we appreciate the good thoughts, and she's resting, and we're following those protocols as she is and I am. We have a son at home as well, and appreciate again your good thoughts, and everybody's doing okay so far, keeping our fingers crossed.
All right, thank you, Mayor. From Emily Ernstberger from the Herald Times, for Brian Shockney, she writes, Maria Doty sent out data on beds testing in ICU this morning. The ventilator number is 48% use, but out of how many? And the same question for the 59% ICU beds. And to clarify, are these numbers for IU Health hospitals across the state or just in the South Central Indiana region?
So the 48% and the 59% are statewide. The reason those are statewide is because we're continuously moving supplies throughout IU Health and its many facilities across the state. As we've seen, the west side of Indianapolis, downtown Indianapolis, and the Carmel area really took the surge quicker than the rest of the state. And so we had to shift our supplies, and even some of our nursing personnel from around the state have gone to help and support them as well, and other types of technical personnel. So that number is a number that's continuously changing, but it's overall the percentage of ventilators across the state of Indiana that are being utilized. So some facilities will be a much higher percentage than others. And then from the ICU beds, the 59%, that's those beds that we currently classify as ICU. And why there's not a total there is that number changes. The state of Indiana State Department of Health has been working very hard, has been in almost all of our facilities in the last few days to certify new rooms that are being qualified. They were medical surgical rooms before, but they had the equipment in the walls and that kind of thing for an ICU room. We've converted those through negative pressure, additional equipment, those kind of things to turn those into ICU beds to prepare for a surge. And so those number of ICU beds continues to change. It continues to increase in number. So that's why we're giving a percentage, because it's that number moves based on each time the State Department of Health visits one of our facilities to certify one of those rooms, and negative pressure rooms and ICU rooms. And we're continuing to add more as we go.
Okay, question from Abby here. So what housing options are there for homeless to isolate them before they get the virus, since it seems that Shalom and other places are full to capacity, and it is not a good option to cram people together in shelters with beds close together? I know that Shalom certainly doesn't have the capacity to deal with an influx. Can the city work with local philanthropists and business owners by renting empty hotel rooms or working with IU to utilize empty dorm space to help people experiencing homelessness before they can even get the virus? So spreads a few areas. Mayor Hamilton, throw to you first.
Sure. Thanks. You can hear me, right? So there's a couple different things going on there. One is the actual sleeping arrangements, housing arrangements, and there's also kind of the daytime situation and what's happening. And your question is correct that we are working with particularly philanthropies and providers to identify how to create more space in the sleeping environments. And that's some of the work that's been going on with a number of partners, some on the phone and others not on the phone, to create more space at Wheeler Mission, at Friends Place, at New Hope, the overnight shelters. They've done things at Wheeler Mission, for example, to spread out the sleeping arrangements, and similarly working with New Hope and Friends Place to do the sleeping arrangements, including the new isolation center and others. And we continue to work on that. That's one of the key focuses of the social service working group, is looking at that housing. Of course, physical distancing is really important during the day too, and that, as some people have seen, we do have some challenges in some of the public parks and other places where we have individuals who are pretty clearly not physical distancing, and we're working very closely with, for example, Shalom, which is a daytime a service provider and helps provide meals and many other services to people in deep poverty or homelessness, working with them to try to work with folks to help improve the physical distancing during the day too. And again, all these collaborations are happening now. There is a need as well for people who are either sick or having symptoms, either confirmed sick or having symptoms, who need the isolation space, or maybe quarantine space if they've had exposure. I'm still learning how to use those words correctly. And that is part of the FSSA, Family and Social Services Administration grant, that we are collaborating with the county, the health department, and others to find ways to get sleeping and daytime living space for folks, including quite possibly at a local hotel. So there's a lot going on this. We continue to work every day and also welcome new ideas with people about that. But the hotels, dormitories, other empty facilities are all being looked at for that.
Okay, let's move on to another question here, which just lost. Okay, from David Askins from the B-Town Beacon. First of all, he says to Mayor Hamilton, all the best to Dawn. And then, do you know if any applications have already come in for the rapid response funding? And then he asks further, is it in single digits or dozens and dozens?
I did just get a report this morning that we've had something like 50 by mid-morning this morning. So that was within less than 24 hours, who have started filling out the site. I believe I saw that it's single digits that have actually completed the full application, which includes financial information and other things. I think it's under 10 as of mid-morning. But dozens and dozens, somewhere around 50, I think, that have begun filling out the application process. And I guess we can see which parts they filled out as it goes. We encourage everybody to go to the city website. You can find that and see what you can do.
And the magic of technology, Mary Catherine Carmichael has typed in here in the chat, approximately 5 completed submissions, approximately 55 pending. So there's the exact answer.
Oh, I got an update of 66 applications started. So while we're talking, I guess there's still things going on, but thank you.
Things are indeed going on. Let me see if we have another question here. And by the way, to our media who are watching, all of you are watching, this is not currently streaming live on Facebook for some technical issues of Facebook change, but the replay will be up there afterwards is what we're working on now. A question about how do we encourage our coworkers to wear masks, especially those of us who perform residential delivery, like home delivery of the HT. Just one infected delivery driver is a potential danger to hundreds of customers in their homes, is the question. So how do we encourage people to wear masks when you're in a co-working situation? Any thoughts? Allison, maybe?
At this time, it's just a recommendation, but so you could just encourage your coworkers that this is the CDC and Monroe County's recommendation, and push that encouragement of that recommendation onto them. Unfortunately, it's not something that obviously could be forced. So,
Chuck, I'd like to weigh in. What we did here is my wife's a sewer, and she's one of those that's made a couple hundred masks already, and I brought them into work and handed them out and said, here's an opportunity. The CDC says this is a good idea. And so we're not going in each other's offices at all, and our mailboxes are outside our doors. But when you walk down the hallway and you go to the bathroom, or you go to the kitchenette and get coffee or whatever, I'd really like for you to wear this mask. Star Wars masks, all kinds of things that have been made. So be creative, and handkerchiefs can work as well. Lots of stuff out there on YouTube. But I would encourage you, it doesn't cost much money. You might be able to pick some up at our Miller Drive office, Miller Drive Community Health Place. Pick up a few masks there if you call there. But I would just hand them out to your coworkers and just remind them that it's important for all of us to be safe and to make sure that we don't spread this virus.
Thanks. And we have a little over 5 minutes left. Are there any media questions that media want to pose here on the actual broadcast? There was a question, okay, from Emily Ernst Berger. Now that IU Health testing is available, this is for Brian, for people experiencing symptoms, how is it determined who gets tested, such as the Parks and Rec employee diagnosed earlier?
Yeah, so when we were doing public, the same criteria, now that we've gone into phase 3, the same criteria are required. You have to have certain symptoms. If you've been exposed, certain exposure requirements. And so the nurses have an algorithm that they use across the state, and they just ask you certain questions regarding where do you work, who have you come in contact with, have you been in contact with someone who has been positively diagnosed, what symptoms do you have currently, and then for our public health workers, and healthcare workers, where do you work, and who do you come in contact with as you work, and then those criteria are all put together, and then your physician or the nurse that you're calling into makes that call as to if it's a good idea for you to get tested at that time. We find that some may just, beginning of, I have allergies, so, I've had to restart my allergy medicine. I could have called in and said, I feel like I have asthma as well, so, I'm getting tight in the chest. Well, that's the tree that's blooming outside my office. I could have called in and they would have said, no, we're not going to test you. You have asthma, you have allergies. You've just got, you're a little tight in the chest. That's kind of normal this time of year. However, if I displayed a lot of other symptoms, such as the fever, runny nose, diarrhea, sore throat, coughing, those kind of things, then they're going to take that into consideration and make the call as to whether you need to be tested or not.
And
go ahead, Mayor Hamilton.
Maybe I should just add, since the reference to the Parks and Recreation employee, and we're very careful to protect the identity of our employees unless they choose to self-identify. So I won't give any detail about it, but I will note that they were tested through the health system protocols and through the treatment regime with the health system. It's also probably worth noting, and Brian knows this better than I and others, that the testing protocols are surely going to continue to evolve quite substantially. I mean, as you watch the national news and state news and different things, we're going to be looking at very different testing regimes as the weeks and months go forward, whether we move from quicker and more easily accessible tests to even surveillance testing and other things like that, we're just not there now, but that stuff is going to continue to evolve as we're able to do more with the testing.
Okay, I think we are just about out of time here, but again, thank you to everybody for being here. We will again do this next week, and we will hopefully be streaming on Facebook again at that time, but we'll be here on Zoom and answer questions, and advisory will go out as per usual next week as well. So thanks to everybody for joining.